Dr. Zorba Paster is here taking your calls at 608-270-9933. Good to see you, Zorba.
Good to see you guys.
So, if you go to any health facility in Dane County, UW, SSML, you still have to wear a mask.
You still have to mask up.
So what's going on with that?
Well, first of all, we've seen an uptake, obviously, in COVID. And wearing a mask is important to prevent it from spreading. So it's not only to you, but it's also, obviously, to the people who are around you. So those are really very important issues, and that's why we're masking up more and more. The important thing is that we still don't have anywhere near the number of people hospitalized that we used to, and that's because so many of us are immunized, but still, not everyone is immunized. So I always want to remind you, if you haven't gotten immunized, get immunized. It really will make a difference.
And even seeing more at the grocery store, at stores, more people bringing them out again.
Right. So you just bring them out, and if you're in doubt, wear the mask. That really is the important thing to do, because wearing that mask can really make a big difference. And that's why I always say, when in doubt, wear the mask. Be important.
And Dane County is in the high category again.
High category at this moment. Who knows what tomorrow will bring in the next day. And the real issue is with flu season coming up, when we start being indoors, we can expect COVID to spread even more than it has right now.
All right, let's go to Terry in Waterloo. You're our first caller. Go ahead. Terry,
Hello?
you there?
Yep.
Go ahead.
Yesterday I went to the hospital to see, actually I had a doctor's appointment to see my heart doctor. They took my pulse and everything, and my pulse was over 100. So the doctor asked me if I was dizzy or anything, and it came down to the point where he found out I was bleeding from my rectum. And he found out it was my hemorrhoids that were bleeding. Now, why didn't he cauterize my hemorrhoids yesterday?
Well, first of all, we don't do that on an emergency basis. That's important. But if you're bleeding from your rectum, the real question is, especially if you're over the age, over the age of 45, is to find out if it's from your rectum or is it somewhere in the colon. And that's where it's important for a physician, nurse practitioner, or a physician's assistant to determine when you had your last colonoscopy to make sure it's not colon cancer. And then, of course, we don't do that acutely. One of the ways you do to actually stop bleeding often is to use a sitz bath, something that you can actually buy at Walgreens and so on.
Okay.
All right, up next, Julie from Madison. What's your question?
Hi, my question for Dr. Paster is, why don't Madison public schools reinstitute the mask mandate when obviously we're back up to high levels, and if you look at healthcare institutions, they all keep the mask mandate in place. And also the fact that students are not getting vaccinated at the rate we'd like them to be.
Sure. That's a political question. It's not a medical question, but you're right. I think it's really important. You've got a balance between what kids are doing at school and the right thing to do actually from that point of view, and I think they just vote on it and they make their own decisions.
They're recommending that kids wear them, but they're not mandating them.
Right. There are a lot of issues involved. They're very, very difficult issues to answer.
All right. Let's go to James in Partyville. Hi, James.
Yes. I wanted to ask the doctor, I got 4 shots already. I just got my flu shot, and I asked my doctor what about the 5th one, and he said, wait, because something's coming up down the line to get the 5th one.
That's right. That's exactly right. Right now, we do not have the booster that's probably going to come out sometime in September or October. It's going to be a booster. The question is, what sort of variant is going to be hit by the booster? The CDC is now looking at the variant that they think should be manufactured. Europe, apparently in the UK, they're looking at a different variant, but there's going to be a different booster in September. That will be the time to get it, and October.
All right.
Janessa from Janesville, what's your question?
Hi, I have a lot of acne, like on my face, and I'm wondering if that's from stress. I'm 44 years old.
Well, definitely, as we know, acne, stress and acne go hand in hand together. There often is the acne that you get as a teenager, and then there's sort of adult acne called acne rosacea. Rosacea is also the common name. This is, if it doesn't get better, talk to your doctor, because you may need a different medication that is not the usual over-the-counter acne medication.
Okay, we are out of time. Thank you all for calling. We'll do this again next week. Are you on next week? Okay.
Yeah.
We'll see you then.